Good day, everyone. This is Dr. Simon Wong. I am an intensivist working in Sydney, Australia. In order to properly manage patients with tracheostomies, we must know not only the anatomy of the neck, but also to have a firm and confident understanding of the anatomy of a tracheostomy device. This way, if there are any issues, we can troubleshoot in a systematic and logical manner. In this video, we will go over the different types of tracheostomy tubes currently available in Australia, as well as the many variations that pertain to its effective management. The two most common brands of tracheostomy tubes used in Australia are Portex and Shirley's. Regardless of the branding, the basic anatomy for all brands is the same. If we look at the simple Portex standard to our top left corner, it consists of a faceplate used to secure the tube in place and prevent dislodgement. As you can see on the faceplate, there are different numbers corresponding to the anatomy of the tube itself. If we look closely here, ID 8 mm is the internal diameter of the inner cannula. OD of 11.9, which is the external diameter. C is the total length of the trache tube itself. That's 75.5 millimeters. We can see there is a outer cannula. There is a inner cannula that's placed within the outer cannula. And if you can look properly, says 7 millimeters in diameter. There is an inflatable cuff to protect the airway and prevent dislodgement. And finally, we see there's a pilot balloon that's linked to the cuff. The pilot itself contains information as well, including the inner diameter as well as the outer diameter. As we can see on the board, there are many variations of the tracheostomy tube. Some provide fenestration so that in particular configurations, gas can travel from the lungs up past the tracheostomy tube and past the vocal cords to facilitate speech. In this instance, gas will be passing from the both inner and outer cannula, and as you remove the inner cannula, instead of gas coming out to the atmosphere, it passes through these fenestrations up to the vocal cords. There are also different lengths of tracheostomy tubes to cater to different size necks. For example, here we see Shiley XTL proximal and XTL distal. As you can see, both of these tubes are configured differently and provide different length for different types of necks. There are also Portex Uniperk adjustable flanges, whereby the mechanism here is such that the trache tube itself can be manipulated to provide different lengths of the thickness of the neck. And finally, there are different mechanisms in place to fix the inner cannula to the outer. For example, with Portex, as before, you can see the cannulas are simply snapped on to the end. Whereas for Shiley's, there is a rotational locking mechanism to secure the inner cannula to the outer cannula. Familiarizing yourself with the different types of tracheostomy tubes will help your troubleshooting process if any emergencies occur. You must remember the basic principles, regardless of the different types, however, remain the same, to provide a patent and protected conduit from the outside atmosphere to the trachea so that oxygenation and ventilation can occur.